Hi, everyone. This is Dr. Samantha, the maternity mentor. Welcome back tonight to another live Q&A session. Here we go at the Maternity Mentor channel. Before we begin, I just want to make sure that everybody knows, please click the like and subscribe button and check out all the content that we have on our channel. We also have a YouTube besides the YouTube page, we have Facebook, Instagram, and Twitter. So also check those out for additional content. And before we get going tonight with our viewers' questions, I just want to remind everyone that if you have any questions that you want to ask here, just type them in the chat box and we'll make sure to get to them. All right, everyone. So again, this is Dr. Samantha, the maternity mentor, and we're going to start by answering some of our viewers' questions. So our first question has to do with bed rest. Which type of bed rest do you recommend for bleeding for a 24-week pregnant woman? All of the ultrasound reports show normal cervical length and placental position, but the mom is 1 centimeter dilated. Which type of bed rest do you recommend? So bed rest is a very tricky question that a lot of people have thought about, ask about, wonder about. So it used to be when there were any maternal complications, we recommended that a mom would have bed rest. And bed rest would look just like that. She stayed in bed all the time except maybe to use the restroom. But now we realize that bed rest is not necessarily the healthiest thing for a mom or for her babies. So, for example, when you are on bed rest, you are immobile. This puts anybody, male or female, all ages, at risk for blood clots. But blood clots are especially challenging for a pregnant woman. Pregnant women tend to clot more. This is a protective mechanism to prevent you from bleeding. So if you're laying immobile or not moving in a bed for long periods of time, this is going to cause you to potentially develop a blood clot. If that blood clot was to travel to your lungs, that would put your life in danger and therefore your baby's life in danger. So what we've learned is it's very important for mom to be moving around to help prevent this. Additionally, laying around for long periods of time causes you to not breathe deeply. When we breathe deeply, it helps expand our lungs, and this prevents pneumonia. When we lay around, secretions will tend to just sit inside the lungs, and over time, that can develop bacterial infection, which causes pneumonia. Again, pneumonia can be life-threatening not only for mom, but for baby, because pneumonia stops us from circulating oxygen properly. So those are two main risk factors of bed rest. Now, in this case, the question mentions or references two things. The first thing it references is cervical length. So the cervix is the opening between the uterus and the vagina. And it kind of looks like this, where this is going to be the opening that dilates when the mom goes into labor to have the baby. So cervical length refers to how long the cervix is. And as labor progresses, the cervix shortens because it opens up and thins out to let the baby's head pass. So a normal cervical length is going to be a long cervix, okay? Now, 1 centimeter dilated. A lot of people get very nervous when they hear about any dilation prior to full-term labor and delivery. But the reality is many moms, especially moms who've had at least one baby, will walk around 1 centimeter dilated for most of their pregnancy and have no issues whatsoever. So 1 centimeter, again, is just 1 centimeter. Now, in this case, bed rest wouldn't necessarily help either one of these things. Now, from a bleeding perspective, it depends on what is causing the bleeding. So what I would tell you is bed rest may not be the right option, but almost like a light duty, light rest could be. So bleeding can often be caused by strain. So lifting heavy objects, carrying around heavy groceries, doing strenuous activities like laundry, like cooking where you're on your feet for an hour or more. These types of things can increase your risk for bleeding. So for a mom who's experiencing bleeding, what I would tell her to do is to take it easy. When she gets tired, she takes a rest. When she needs help, she asks for it. When it's time to cook meals, try to go for some quick and easy meals versus those long, arduous home cooking meals, because sometimes standing on your feet for that long is no good. The important thing is to keep yourself moving, but within reason. Now, she talked about placental position. Sometimes bleeding is caused when the placenta lies on top of the cervix or very close to the cervix. So a normal placental position is a placenta that's away from the cervix. Knowing some of these things, the biggest question is, why is she bleeding? So depending on the answer to that question, your healthcare provider may be telling you to do complete bed rest. If this is what your healthcare provider is recommending, you need to do so, because again, I don't know the full extent of the health situation. However, if your healthcare provider is saying to you, no, bed rest isn't necessary, just take it easy, maybe you're able to move around and do your normal household duties, but you're not able to, say, work at your regular job, you need to follow those guidelines. They may be allowing you still to move around because this is the best thing for the health of yourself and your baby. Hi from the Philippines. Welcome. I'm so happy to see you joined us tonight. Remember, guys, you can put any questions you have inside the chat. So every week we have a lot of questions about bleeding, so I'm going to go ahead and get started with some of those. I've had my period for the last 9 days straight after 9 months of having my baby, having delivered a baby. Is this normal? So the answer is absolutely. So after we have delivered a baby, our periods take a little while to get back to normal. It's actually very common that 1 month before you actually see your first period or menses or bleeding, you may actually have all the symptoms as if it was going to come and it doesn't. So that could include cramping, bloating, emotional issues. That is all because your body is getting back into the routine. Those hormones, they're correcting themselves, they're stabilizing, and they're normalizing. So one of the things you need to know is that that period may change. So then your next month, maybe you have spotting, maybe you have a really heavy period. It could be short, it could be long. It is normal for it to have changed because, again, your body's getting used to its new normal. And a lot of women will say that prior to having a baby, for example, their period hurt. And now they've had a baby and they don't have any more pain with their period. That can be normal. The reverse can also happen. Women who didn't used to experience painful periods can all of a sudden have them. It's just your body's way of adapting to having had a baby and the changes that occur to the uterus. While your uterus does contract back down almost to normal size, there are changes that will never go away completely. And that's some of the things that your body's kind of, showing its signs of adjustment. Okay. Now, the next question about bleeding. I'm 6 weeks pregnant and I've had light brown spotting with white slippery discharge 3 times a day for the last 2 days. But today that brown discharge changed into red blood, but there aren't any more clots. Blood is also not very light, not enough to cover a pad. Is everything okay? So this is a very good question. 6 weeks pregnant, very early on, and a lot of moms are just finding out that they're pregnant at this time. Brown blood is a sign of old blood. This means bleeding had occurred and that blood was drying up, and that's when you see it. Now, when you see brown blood turn to red blood, that means now we've got very active bleeding, and that's not a good sign during pregnancy, especially early on. This can actually be a sign of miscarriage. Now, the interesting part of this is that she describes white slippery discharge. So this actually sounds like it could be normal discharge for early pregnancy. It's very common for us to develop a very clear kind of mucousy type of discharge, which is designed to help protect the uterus from infection. So there are times where bleeding early in pregnancy can be normal. So one of the reasons why bleeding can be normal early on is if you've had sex. So the hormones that maintain your pregnancy thin out the vaginal tissue. So after having sex, a lot of times you'll end up with a tiny tear, and this tear can bleed, which you then see on a pad. It'll usually show up very small, and you won't know for sure whether something major is going on. Ultimately, the most important thing when you see bleeding during your pregnancy is to contact your healthcare provider. So your healthcare provider is probably going to want to assess the situation. They may decide to order an ultrasound to check for the placenta and the baby. They may decide to do blood work to see if the pregnancy has maintained itself and whether your HCG levels, which is the hormone that we detect in the blood for pregnancy, is going up. But ultimately, you want to make sure that your healthcare provider is on board so they can assess the situation. The next question about bleeding. My OB said that I have many polycystics on both ovaries. I'm 5 weeks pregnant. What are my chances? Okay, so I believe that this woman is describing polycystic ovarian syndrome. So when she says polycystics, poly means many, and cystics means cysts. So cysts are kind of like little bubbles that sit on the surface of the ovary, and they can burst and cause pain. Now, this condition can lead to infertility, which is why it's so important for people to understand the condition and what to do about it. Now, once a pregnancy has started, really polycystic ovarian syndrome should not affect the ability for the mom to stay pregnant. She will be monitored closely, and she's at a slightly higher risk of developing gestational diabetes because part of polycystic ovarian syndrome is insulin resistance. The other thing is mom may have been put on certain medications for her PCOS, and she will need to possibly come off of those while she is pregnant. However, having these cysts on the ovaries does not necessarily change the outcome of your pregnancy. The uterus is where the baby is, and the ovaries are outside of that. So even if those cysts were to become bigger, they shouldn't affect the baby's ability to grow. All righty. So our next question is about breastfeeding. So my child is 6 days old. He is not interested in breastfeeding. Can you please suggest some tips to feed my child? So this is a great question. So one of the things that I love talking about is breastfeeding and formula feeding. I've been a lactation consultant for over a decade now, and I'm a strong proponent of both. So unfortunately, this question doesn't have everything I need, so I'm going to kind of speak in generalities. So the first thing you need to understand is that babies will breastfeed best when they are born 39 weeks of gestation or later. Babies that are born before 39 weeks are considered premature, which is a very different thing than we used to think a long time ago. So from like 36 to 39 weeks, the baby is still going through a lot of brain development. And one of the things that develops during that time is the baby's ability to coordinate sucking and swallowing, as well as some muscle tone and just energy. Okay. So if a baby is born, say, at 37 weeks, these babies are often very sleepy and they really can't get it together to figure out how to breastfeed properly. So these babies need a lot of extra support. And one of the things that helps them out a lot is to be supplemented. So sometimes in the beginning, you have to use a little bit of formula until mom's milk comes in, and then you can use mom's milk or you can use both. Now, in order to stimulate a baby who's not interested in breastfeeding, you need to make sure the baby is hungry and the baby is ready to eat. That means wide awake. So a lot of parents get very concerned when their baby isn't eating. A 6-day-old baby should not go longer than 4 hours without eating. Period. End of conversation. If this baby isn't eating at 4 hours, you need to put a bottle in the baby's mouth and feed the baby. However, if the 3-hour mark has hit, you don't have to panic. What you can do is take the baby out of their clothes and put them skin to skin with mom. This will hopefully start to stimulate some of the feeding behaviors. Next, you can actually let baby get a little cold. Now, when I say a little, I mean a little. So when the baby's skin to skin with mom, she's going to help regulate the baby's temperature. But putting a little cold washcloth or cold baby wipe on the baby's back to kind of wake baby up is okay, and it's safe for baby. Now, once baby starts to get going, you want to put baby at the restaurant. The restaurant is the breast, okay? Keeping baby's mouth very close to the breast allows baby to smell the breast milk, to be near where we want baby to eat. But just because baby's there doesn't mean baby's going to suck. So if your baby had difficulty breastfeeding in the beginning, oftentimes this means you end up giving formula, and that formula is in a bottle. So bottles are super easy for babies to eat from. The flow just comes out super quick. The baby doesn't have to do anything, and the baby just gulps down milk. So now when you put the baby at the breast, the baby doesn't want to work for the milk because the baby knows there's something else out there that's easier. So one of the ways we can coax baby to try to suck at the breast is to trick baby. So what I tell moms to do is put the baby's mouth right next to the mom's nipple, but then feed the baby a tiny bit of formula or breast milk, whatever you have, in a bottle with the nipple right next to your nipple. Now, when I say a little bit, I mean a little bit, like 4 or 5 sucks, enough for baby to go, oh, it's time to eat. Then what you're going to do is you're going to pop that bottle out, put a drop or two of milk onto your nipple, and try to get the baby to latch. The baby will most likely at that point taste that little bit of milk that it just tasted from the bottle and go, oh, that's right, I'm supposed to suck. And your baby will oftentimes suck 4 or 5 sucks. Then baby may get a little frustrated. Baby may cry. When this happens, take baby off the nipple, but don't move the baby. Keep the baby at the restaurant and start that process again. The idea is to teach the baby that when the baby is there in that position at your nipple, baby's going to get fed. And slowly over time, you can put baby onto that breast. Now, some babies who've had a lot of bottles for whatever reason may also require a nipple shield, which is a piece of plastic that goes over your own nipple, because they feel that plastic and they associate it with milk. However, don't ever use a nipple shield unless you've been taught how to use it by a lactation consultant. Nipple shields come with some risks, including possibly causing your milk supply to go down. So you want to make sure that you know that you're using it properly and that the baby can transfer milk. Now, one of the final tricks is if your baby has been using bottles, your baby is not going to go to the breast as long as it's used to getting this fast flow of milk. So one of the things I want you to do, and one of the things I tell all of my moms and dads to do, is to learn how to paced bottle feed. Paced bottle feeding is one of the most effective tools to getting a baby from a bottle back to the breast. If you wanted more information about paced bottle feeding, I actually have a video on it, and I'll try to put that link in the description below. All right, let's go on to our next question. So we have a question about depression, and this is coming from one of my viewers. So she is talking about she's talking about bupropion. Okay, so she's asking, is bupropion safe for use during pregnancy? I'm on bupropion 150 before pregnancy. Can I continue that all 9 months? So bupropion is the generic name for Wellbutrin. And Wellbutrin is a medication that can be used for depression. It's also used for a couple other things. It can be used for attention deficit disorder. It can be used for kind of like a lack of motivation and concentration, which is often associated with ADHD. It can also be used for smoking and for alcohol cessation. So bupropion, in this case, I think she's using it for depression. So bupropion is actually okay for the baby, It's not a fantastic medication to use, and certainly one that I wouldn't be like my number one choice if I was looking to medicate a mom for the first time. But one of the things I will tell you is that I do not recommend bupropion during pregnancy for mom. So, one of the things you need to know about this medication is it reduces your risk of seizures because it is sort of like a mood stabilizer. So, as a mood stabilizer with a reduced risk of seizures, if you were to come off of it, it would increase your risk of seizures for a short period of time. So, you have to be tapered off. Well, seizures are a risk that we worry about with moms, especially closer to the end of pregnancy if she develops high blood pressure with a condition called preeclampsia. So we don't want to put mom onto anything that will reduce her seizure threshold and make it easier for her to have a seizure. Thus why we don't want to use bupropion during pregnancy. So if you are on bupropion when you become pregnant, what you want to do is you want to work with a healthcare provider to wean off of it and look for something else that you can be put on, or see if there are any homeopathic remedies instead. Now, there is one caveat to all of this. If you are potentially suicidal without bupropion, if this is the only medication that has ever worked for you, the literature shows it is better for you to stay on this medication than come off. Depression and anxiety that is left untreated during pregnancy can lead to significant severe outcomes, including preterm birth, miscarriage, and even a stillbirth. Babies also born to a mom who has untreated depression or anxiety will oftentimes be low birth weight. They'll have respiratory distress. They'll suffer from low blood sugars. So it's very important that you treat your depression and your anxiety if it's present. However, if you work with a healthcare provider who's an expert in this field, you may be able to find a variety of alternative medications that may help for you. So we got some mamas coming in. Hey there. I'm so happy that you've been able to join us. I see we have somebody from Australia. Feel free to type in the chat any questions you might have and where you guys are coming from. All right. So let's go on to our next question, which is about diabetes. So I was diagnosed with gestational diabetes at the end of my 13th week. Due to limited carb intake, I was not gaining weight. I went on losing weight. Will it cause any problems to my baby? So this is a great question. So losing weight during pregnancy is not always a bad thing. So when I was pregnant, I had terrible hyperemesis gravidarum, which is a severe form of morning sickness. And I lost a significant amount of weight with both of my pregnancies. In fact, my second pregnancy, I didn't gain an ounce. I lost the entire pregnancy. But I gave birth to 2 healthy full-term babies that were of regular weight. Our bodies are amazing, and they will do everything they can to protect your baby and make sure your baby is well nourished. Now, gestational diabetes with limited carbs does not mean that you have to limit your calories. And this is a mistake a lot of people make. One of the things that you can do to help keep your calorie count up is to increase your protein and your healthy fats. So proteins include all of your meats, your cheeses, a lot of dairy has protein, as well as nuts, okay? And then, of course, healthy fats include stuff like olive oil and avocado and the like, okay? And now when we come to carbs, there's simple carbs and there's complex carbs. So simple carbs include like your cakes and your cookies and all that stuff that you really shouldn't be eating anyway. But some of the more complex carbs could include something like a red pepper, which has a lot of fiber and other things in it that help balance out the sugar that's contained within that red pepper. Now, one of the things that I'm a big proponent of is the keto diet. Okay, keto has gotten a lot of bad publicity because I don't think people understand how keto works and how it can be safe for pregnancy. So keto is low carbs, high fat, and high protein. And what I like to recommend to my patients is dirty keto. So dirty keto is a much looser version. This is where somebody will take a keto food list, make sure they eat within moderation, and they stick to those foods. And if you look at a keto food list, oftentimes it's very much in line with a gestational diabetic diet. So keto focuses on low carb, but it doesn't mean no carb. So for example, one of the things that you can eat on keto is berries. And when you look at berries compared to, say, pineapple's full of sugar, and it's no good for you when you are on a gestational diabetic diet. But berries are full of fiber and much lower in their carbohydrate content. So they're a really good alternative as a grab and go for moms who need lower carbs. Keto also promotes dairy products, which are very common when you have diabetes and are looking to reduce sugar. But one of the things that keto shows us is that where everybody has always told you you should go fat-free for your dairy, that's actually not the case. When you have a fat-free milk, let's say, when that fat is removed, what's left in that milk is mostly lactose, which is sugar. Okay, so you're basically drinking a ton of sugar. Yes, there is some protein in there, but not enough to really make a difference. Instead, whole milk is actually a better alternative because you get all of that healthy fat from the milk within there. And there is sugar as well. And that's why when you drink, say, a glass of whole milk, you want to drink in moderation. So I would tell you that if you can look at all of the foods that you have in front of you, you may find that you can actually gain weight and still maintain your gestational diabetic diet. Now, one of the other things that I would tell you is to ask your healthcare provider to refer you to a nutritionist that not only specializes in diabetes, but also specializes in pregnancy, because your nutritional needs are going to be very different from, say, a regular adult diabetic. These nutritionists can help guide you into what foods are healthy or not healthy. So for anybody who's joining us, thank you for attending our live Q&A. We're doing these every Monday night at 9 p.m. I'm Dr. Samantha, the maternity mentor, and I just want to welcome everybody who's here and remind you that if you have any questions, you can pop them in the chat and we'll try to get to those as well. So I have a question actually. Hello, I'm 8 weeks pregnant and I have a UTI, but I can't find the cefuroxime 500 milligrams in any pharmacy in our city. My doctor recommends that medicine. Is it safe for my baby? So it's a good question. Cefuroxime is safe for your baby during pregnancy. What I will tell you is that it's very important for you to get that urinary tract infection treated, the UTI, urinary tract infection. Urinary tract infections that are left untreated can lead to serious complications, including a kidney infection, which is also called pyelonephritis. And that can be extremely serious for you, mommy, and you might end up in the hospital. So one of the things you want to do is if you cannot find this medication, you want to go back to your doctor and see if there's other alternative medications you could use. For example, two that I can think of would be macrobid or amoxicillin. Now, a lot of times when we're given an antibiotic for an infection, we start to feel better a couple days after starting the medication. It's very important you finish all the medication even after you start to feel better. What people don't realize is that that antibiotic has killed off enough bacteria after those first couple days that you don't feel bad, okay? But you still have bacteria in your system. If you stop taking the medication, that bacteria that's left, it gives it a chance to start growing and rebuilding its population. So then in a week or two, you're sicker than you were before. But now the same medication won't work because that bacteria built up a resistance to it. So now your doctor is left to have to give you a stronger medication or the same medication, but for a much longer period of time. We're all very worried about taking medication when we are pregnant, but there are certain medications that are necessary for our baby's health. An untreated UTI can also lead to miscarriage, it's stillbirth, and preterm birth. So trust me, when your doctor is giving you this antibiotic, this one is safe. You want to make sure you take it all. And I really hope that you feel better. Now, while you're waiting for that medication, there are a couple other things that you can do. But again, these do not replace antibiotics. They can only help. First of all, drink plenty of fluids. Water is ideal, okay? But anything you can get your hands on is probably better than nothing. The more you pee, the more you can pee out that bacteria, which is only going to help things. Now, the next thing is you want to make sure that you're showering daily. And when you use the bathroom, you wipe from front to back. This helps prevent any other bacteria going up into the bladder to make that infection worse. You also want to make sure you're changing your underwear regularly. So when we're pregnant, sometimes we leak a little bit of urine. So if that's happening to you, change your underwear multiple times per day. Otherwise, make sure you're changing it once per day and wear cotton underwear only. Cotton underwear is breathable. The vagina is dark and moist by its own right, and that encourages bacterial growth, and we want to discourage bacterial growth. So during the day, wearing breathable underwear is very important. And then at night, if appropriate for you, you want to go without underwear, allowing more air to circulate. Now, the last thing I'm going to tell you from a homeopathic standpoint with UTIs is let's talk about cranberry juice. So back 15 years ago, there was a whole bunch of studies basically saying that cranberry juice could prevent and treat urinary tract infections. Since that time, the evidence has gone back and forth. So some people say that it does. It makes the urine more acidic, which helps kill the bacteria. Other studies will say that it helps kind of detach the bacteria from the walls of your bladder, which flushes it out of your system. What I will tell you is that the evidence is mixed. But as long as you don't have gestational diabetes, if you get a natural cranberry juice that does not have any added sugar and you want to drink some of that every day, if nothing else, it's just more fluid, which will help you urinate more often, which is important. And if it gives you a little bit of extra benefit for your urinary tract infection, then that's a good thing, because there are some women who swear by cranberry juice. Thank you for asking your question. All right, so our next couple questions are about drying up breast milk. So the first one comes from a partner who says, my wife wants to dry up her milk because she has a very low supply for the baby. The baby is on formula and he is 1 month old. Are there any tips to increase milk supply? So this is a good question. One of the things that I would tell you is at 1 month old, it can be a little challenging to go ahead and increase milk supply. But the number one way to do it if the baby is not latching is pumping. If you pump every 2 to 3 hours for 15 to 20 minutes, you can increase milk supply, but it has to be around the clock. Now, a couple other things you can do to help increase milk supply is to make sure that you're drinking plenty of fluids, make sure you're getting plenty of rest. You can go ahead and you can take certain galactagogues. These are like substances, medications, and like vitamins and supplements that help increase milk supply. One of the most common ones is fennel. So I have told some women that they can get a very natural fennel oil from a very good quality essential oil company like, say, doTERRA. And you can put a drop or two of that fennel oil in a drink every day, and that can help increase your milk supply. Okay. Lactation cookies are oftentimes a very good alternative for a lot of women because they contain a lot of different things like flaxseed and fennel and oatmeal and stuff that can help increase milk supply. Again, these things don't increase them like crazy, but they can help. You will find some over-the-counter products like Mother's Milk Tea, which is a tea that combines a lot of different herbs to help increase milk supply. Now, there is one protocol that's used with a medication that's prescribed by your doctor. The medication is Reglan. Reglan is a medication that we use for nausea in a lot of people, men and women. there is a protocol that some people have heard of where you can give Reglan to a patient within a 10-day period of time at an increasing amount. Now, this is usually only prescribed by an OBGYN who's familiar with the protocol. But one of the things you need to understand is that this protocol is not appropriate if you have any history of depression or anxiety. One of the side effects of this particular protocol with the increased Reglan is depression. And when you are postpartum, you are at increased risk of postpartum depression for anybody due to the variety of changes that happen both hormonally and socially between, the adjustment to your new life and lack of sleep and the like. So if there is any pre-existing history of depression, even if it was 10 years ago, you cannot and are not eligible for the Reglan protocol. And I want to make sure that that's very clear. Now, on the other hand, this question talks about how the mom would like to dry up her milk supply. So let's talk about that. One of the biggest things you have to do if you're going to dry up your breast milk supply is you need to stop stimulating the breasts, okay? So you don't want to pump. You don't want to have a lot of contact there. When you get in the shower, you want to make sure that you're allowing warm water on the back, but not a lot of warm water on the front because warm water stimulates breast milk supply, okay? Cabbage leaves. These have been used for like hundreds of years. A lot of people think it's fake, but it's actually real. So you get a head of cabbage, clean the leaves, and put them into the refrigerator. When they're nice and cold, you can place them inside your bra and keep them there until they're wilted. And you can do this 24 hours a day until that milk is gone. The cold helps to constrict the blood, which helps to stop milk supply production. But in addition, some of the chemicals in cabbage also help to get rid of your milk supply, okay? Now, ice, you can ice your breasts 2 to 3 times a day for up to 20 minutes. Make sure you're using some kind of cloth or barrier in between. And then you can ask your healthcare provider if you're eligible to use Benadryl or Sudafed to help dry up your milk supply. So there are some risks with both of these. Benadryl can make you very sleepy, so you may not be able to drive a car or go to work or make any type of decisions. And Sudafed can cause your heart to race and increase your blood pressure. So you want to make sure you're eligible, but both of these substances can dry out your milk if you're allowed to use them. Another natural remedy that you can use is peppermint. You can suck on peppermint candies or you can drink peppermint tea, and both of these can help reduce your milk supply. All right, so it looks like we have another question in the chat. How about prenatal vitamins? What time to take it, in the morning or the evening? So thank you for the question. So prenatal vitamins, whichever you like. A lot of moms will complain that their prenatal vitamins make them feel kind of sick to the stomach. So as a result, we oftentimes tell moms to take it at night when they go to bed so that hopefully they sleep through some of that discomfort. Now, the nice thing is there's a lot of different forms of prenatal vitamins now, including gummies. Gummies are like the favorite thing for everybody now, and the gummies are usually well tolerated. So if you wanted to take your gummies throughout the day, you could. One of the things that's very important is make sure you're checking the back of the bottle and reading the directions carefully. A lot of people assume that they grab any multivitamin, prenatal or otherwise, that you only need to take one a day. Make sure the bottle says only take one a day, because some of these are actually designed for you to take 2 or more, especially if it's gummies, okay? But really, honestly, it lasts for 24 hours, so whichever works for you is fine. I have another question in the chat. I really want to exclusively breastfeed. Would you think it's a good idea to start collecting colostrum milk and pumping before my baby is born so I can have a small milk supply frozen? If so, how soon? This is a fantastic question. I love this question. So, all right. Pumping studies have been done to kind of ask this question. They were first started actually mostly down in Australia, which is a very pro-breastfeeding country. And what they started to find was that when women were pumping prenatally, it helped reduce C-section risk. So the way this happened was these studies were with women who were receiving regular medical care, okay? No pumping occurred prior to 37 weeks of gestation. You should not pump prior to 37 weeks of gestation, period, end of conversation. So some of the studies examined showed with moms starting to pump at 37 weeks where they pumped once per day for 10 minutes. In the 38th week, twice per day for 10 minutes each. And in the 39th week, 3 times per day for 10 to 20 minutes each. Okay. What this did was it allowed a mom to start stimulating the breasts. She could collect the colostrum and then freeze it, as you suggested in the question. And it also stimulated some contractions, which helped to ripen the cervix and help prevent cesarean section. Now, these studies were done prior to what we now know as the 39-week rule, which is basically that your baby is not full term until your baby is 39 weeks or greater. Okay. We do not want your baby born at 37 weeks pregnant. Okay. That baby is still having a lot of brain growth that's actually essential to breastfeeding. Okay. So what you want to make sure is that you do not start pumping unless you have been directed to do so by your healthcare provider. For example, if this is your third baby and your cervix is thinning out like crazy at 37 weeks and you start pumping, you could cause preterm birth. And a 37-weeker is preterm, even if the baby doesn't go to NICU. Now, one of the things a lot of moms will do is they will passively collect some of that colostrum that they're leaking throughout the day. Now, you don't want to use something like a haka, which does provide a little bit of suction, but you can just put breast shells inside your bra and you can collect some of that colostrum. If you do collect it, you want to make sure you freeze it and you want to label it with the date and time that you collected it. Because if it is not labeled properly, the hospital will not allow you to use that that breast milk, even if the baby is yours and it's yours. The breast milk is considered medication, okay? And so as such, hospitals have very strict guidelines on how they use it, okay? Now, I would talk to your healthcare provider now. Depending on how many weeks pregnant you are, at 39 weeks, I think it's a fantastic time to start pumping. But your healthcare provider knows your health history best. And there's a lot of little tiny details to that make a difference. But ultimately, I think that could be a great idea. Okay. And then the other thing I'm going to tell you is that if you want to exclusively breastfeed, skin to skin, skin to skin, skin to skin, lots of skin to skin. Okay. The first couple of days are so hard and baby is going to be reversed. Baby is going to be awake at night and asleep during the day. So when your baby is asleep during the day, you need to sleep during the day. Honestly, no visitors. Don't have your friends and family come see the baby. They can see the baby in a week or two. Those first couple of days when you're getting used to trying to breastfeed, recovering from birth and everything, you don't need to be entertaining during the day. You need to be sleeping because like the second night of life, oh my gosh, it is absolutely one of the hardest nights you'll have. They actually have tons of stuff. You can look up YouTube videos and different things. I'm pretty sure I have a video on it that's called Baby's Second Night. And this is because baby wakes up and all the baby wants to do for like 12 hours straight is breastfeed. This is absolutely great for your breast milk supply, but you want to make sure that you are, being cognizant of that. All right. So, our next question is about hemorrhoids. So, at 26 weeks pregnant, I had an incision and drainage to remove the external hemorrhoids. However, 2.5 weeks later, it still itches and I'm unable to walk from the friction. I use Preparation H cream and pads. What can you recommend? Unfortunately, I can't recommend much. You're actually doing everything that you should be doing. A little bit of ice to the area can sometimes help reduce inflammation, but that itchiness is something that you need to talk to your healthcare provider about. It could be that you're kind of having almost like a little bit of a allergic reaction, and possibly a different type of steroidal cream might help take care of that. But one of the things you want to do is, because you did have a procedure there, you want to make sure you talk to the provider that did that so they can assess the situation, examine you, and direct you on what to do next. Another question about hemorrhoids. Is it safe to apply Anusol cream for my hemorrhoids? I'm 7 months pregnant. So always check with your healthcare provider, but generally speaking, yes, Anusol cream is safe for pregnancy. In fact, most hemorrhoid products are safe for pregnancy because they're mostly external, and what little bit is internal is very little of it is absorbed into your system. And Tux pads are fantastic. They help to soothe and shrink the hemorrhoids. And one of the things is having Tux pad on hand after you give birth is fantastic, because especially for a vaginal birth, we'll actually give Tux pads for you to apply to your vagina because they also help to soothe and reduce the swelling after you give birth. I'm so glad you enjoyed the content, Amaj. Thank you so much. All right. So preterm birth. So I had a baby boy via cesarean section 4 years ago. I got pregnant last year. The whole pregnancy, I had a bad vaginal smell. And then my water broke at 29 weeks and I lost my baby. I'm so sorry to hear that. So she says that she got pregnant again and she was treating the infection. And this time her water broke at 24 weeks. Could she have a problem with her cervix? So that question is a question a lot of women have on their mind, okay? So in this particular viewer's case, I would say no, that is not a problem with the cervix without more information. Bad vaginal smell indicates infection, and an infection left untreated can cause preterm birth, miscarriage, and even a stillbirth, because that infection invades the uterus and then it can infect the baby. Now, when a water breaks at 24 weeks, it doesn't mean that the cervix is the problem. In fact, it can be caused by a variety of things. Most commonly is actually infection, okay? When the cervix is an issue is when you start to dilate prematurely. And dilate, again, this is our cervix. It means the cervix starts to open. And yes, when the cervix starts to dilate, you can have your water break, usually because what's causing the cervix to open is contractions. And contractions are where the uterus is kind of pumping to get the baby out and to move the cervix apart. You won't always feel these contractions when you're 24 weeks pregnant. So sometimes women will be having these contractions for a variety of reasons, and then the water breaks. And there will be some cervical dilation also. Most of the time, a bad cervix or a cervix that is incompetent is a cervix that dilates well before this. So you're having a mom who presents with bleeding and she's about 12 to 15 weeks pregnant and they notice that she's dilating. And these moms will oftentimes go into the hospital for a cerclage. A cerclage is a procedure where when you have a cervix that's opening up, they close it and they stitch it closed to hopefully keep it closed for the rest of the pregnancy. If she gets to full term around 37 weeks, they'll go in, they'll take out the thread, and they'll allow her to dilate naturally and give birth. All right, so here is a question about, another question about preterm birth. So I'm 32 weeks, I have a cerclage, and I was on progesterone. But from 29 weeks, I developed signs of obstetric pregnancy. And she started having abnormal liver enzyme tests. So they told her to stop taking the progesterone. So she asked, should I start taking the progesterone again? Should I quit taking Urso? For 3 days, I'm feeling a lot of downward pressure, even though I'm resting. Is there any risk of preterm birth? So there's a couple of things here that are going on. So I can't answer specifically, but what I'm going to tell you is progesterone is often used in the beginning of a pregnancy to help maintain the pregnancy and prevent a miscarriage. We oftentimes discontinue it during the middle of the pregnancy. So no, if your healthcare provider is telling you not to take it, I would not restart it. The urso is not a medication I'm familiar with. So this is either not the name that's used in the United States, or it's just not a medication we use here. So I cannot comment on that either way. Now, downward pressure, even though you're resting, is there a risk of preterm labor? Yes, there is a risk of preterm labor. There's a risk of preterm labor simply from liver enzymes. Once our bodies are starting to show signs of illness, your body is going to try to protect you and to protect baby. If you are not well, baby will not be well. And if baby is causing an issue to you, your body will try to deliver the baby to help correct the issue. So if you're having any type of issues like elevated liver enzymes, like high blood pressure, like infection, your body's going to try to deliver the baby, which is what causes preterm labor. Now, having that pressure even while resting, that's a very good sign that you may be having contractions. So you need to contact your healthcare provider and let them know what's going on, because they may want to assess you, to do an ultrasound, and to check the baby. Next question is about sex. Just like you can't get air in the vagina, what is the possibility of air entering in certain positions? That is sometimes normal and seems concerning. So you can absolutely get air in the vagina during sex. That can happen in a variety of positions. But the nice thing is you don't need to worry about the baby. So a lot of us get a little self-conscious about having sex when we are pregnant because we're just not sure what baby senses or anything like that. So you have the vagina, and inside the vagina sits the cervix. This is the opening that goes up to the uterus where your baby is, okay? That cervix is closed, okay? Nothing really gets through there. There is, of course, an opening because eventually it has to kind of spread apart to allow baby to come down. But that opening is full of mucus, okay? That mucus is the mucus plug that you later on get rid of right before you give birth. It comes out in the toilet. So that mucus prevents any type of air from coming up into the uterus. So you don't have to worry about air getting near the baby at all. Now, one of the things you should know about sex, sometimes after sex, you will have some contractions, especially if you've had an orgasm. People get worried about this. So from the baby's perspective, those uterine contractions from an orgasm are kind of like a massage. They actually don't mind it. They like it. It's very comforting to them. Now, you want to make sure you're well hydrated and you're monitoring those contractions, because if they last longer than a few minutes, then you want to make sure that you're letting your healthcare provider know. And of course, if your healthcare provider tells you for any reason not to have sex, then you shouldn't have sex. But otherwise, if you haven't been told, please feel free to enjoy yourself. It's totally safe and natural during pregnancy. So this question comes to us about thyroid. I just got my blood checked at 5 weeks and my TSH was 8.98. I got it rechecked and I'm waiting on the results. I'm scared that this is going to poorly impact my baby. My doctor is going to prescribe medication and refer me to an endocrinologist. Do you think it's been caught early enough? So thyroid is a gland here that produces a hormone that honestly is like the most important thing for your entire body. It affects like every system in your body. Okay. I test thyroid levels all the time on my patients. So TSH is thyroid stimulating hormone. When that hormone is elevated, that means you don't have enough thyroid in your body. Okay. So that's low thyroid and that can be a problem. Now, yes, low thyroid that's untreated can be a big issue for your pregnancy. Treating that is very important. Your healthcare provider sounds amazing. They're rechecking the level to make sure that that's accurate before treating. That's exactly what you should do. Once they determine that that you absolutely have a thyroid issue, you do need to start taking that medication right away. It's essential for your baby, and you do need to be seen by an endocrinologist who specializes in taking care of women who are pregnant, okay? Your thyroid will need to be monitored throughout your pregnancy. It is very likely your medication will change possibly every single month, because as your pregnancy progresses, your thyroid needs will change. So do not get frustrated with all the blood work and the medication changes. That's normal for us, and it's a good thing. It means that you're getting good care because they're monitoring you closely. Do I think it's been caught early enough? Absolutely. 5 weeks pregnant. I mean, obviously we don't want you to have a thyroid problem, but you got to it at a very good time. So I want you to just follow their plan and you should be good. Now, after you give birth, they're again going to need to monitor your thyroid regularly, and you may find that your medication changes again. After a couple weeks of being not pregnant, you may find that your thyroid goes back to normal, or you may require thyroid medication for the rest of your life. But it's very good that they were able to catch this early. We're close to wrapping up. Please feel free to put any questions into the chat that you may have. My next question is about water. So we're using a bottled purified water with added minerals to mix formula with. Is that okay? So bottled purified water is awesome. Added minerals, not good. So your baby is a tiny, immature human being. The kidneys and the liver are still forming, okay? They're still kind of getting used to what they're supposed to do. They're immature, okay? As your baby grows, those are going to start to function better and better. Now, formula contains minerals in it. That's like, it's got all sorts of stuff in it to make it healthy for your baby and to make it the perfect food for your baby if you're not giving breast milk. And there's nothing wrong with formula. But when you're using a water that also has minerals, you may actually be giving your baby more minerals than the baby should have. So, for example, calcium. We all need calcium. Calcium is very important for our bones. Calcium can be a mineral found in water. But if you have calcium at the right amount already in baby formula and you're adding calcium, this can actually be a problem. What people don't realize is calcium also affects a little bit of our heart rhythm and our muscles and how they function. So you don't need to go crazy over it. There's minerals in tap water. There's minerals. But if there's actually added minerals to your bottled water, you want to stay away from that. Use one that's just regular. All right. So we also have one last kind of comment. I had diarrhea for 2 days now and a bit of nausea. I'm 38 weeks and 4 days. I want to get over with this as a first-time mom. I'm really tired of being pregnant in general, and it makes me feel guilty that I just don't want to do it anymore. So to close out our night, don't feel guilty. At 38 weeks and 4 days, most of us are over it, okay? For this mom who may have already delivered, nausea and diarrhea are actually a very common sign of labor getting ready to start. But you're in the home stretch. And it's really hard to be 38 weeks pregnant with a potentially 7-pound baby in your belly. So the best thing I can tell you to do is lots of self-care. Watch your favorite movies, eat some of your favorite foods, just try to rest, be around your friends and family, because pretty soon that little one's going to be around the corner. So that concludes our question and answer. I want to thank all of you for joining us from the Philippines, from Australia. I'm so excited to see all my viewers from across the world. I want to remind you that on the Maternity Mentor channel, we have tons of content. We're trying to do these live Q&As every Monday at 9 p.m. Eastern Standard Time here in the United States. Feel free to submit questions on different videos that we have in the content, but also feel free to tune right in and you can ask your question live. I want to thank you again. This is Dr. Samantha, the Maternity Mentor, and we're really so happy that you joined us. Have a good one, everybody.